Hello, my name is Madison and I'm joined by Megan. We are occupational therapy doctoral students at the University of Arkansas and UAMS. Today we're going to be discussing neurocognitive disorders and the array of underlying disorders that go with it. First, we're going to start with
Mild versus major cognitive disorders. Now, both of these disorders really exist along a spectrum of functional and cognitive impairment. And the decline in cognitive function is characterized by the individual's previous level of performance and function within their life. So, mild neurocognitive disorders really get set apart because this is just a modest cognitive decline compared to previous level of function, but it still does not interfere with their ability to be independent. And major neurocognitive disorders are really set apart by their significant cognitive decline and the fact that it does interfere with independence in daily life. So some of the causes of these disorders can really fall under a very wide umbrella. This can be Alzheimer's disease, Lewy body dementia, Huntington's disease, traumatic brain injuries, as well as others. And as for the intervention, this really does depend on the cause of the condition and the symptoms that are being experienced by the individual. So interventions may include medication management, just basic time to heal, occupational therapy, physical therapy, as well as other medical interventions. So delirium falls under neurocognitive disorders, and this is defined as a mental disturbance that results in confused thinking and poor awareness of the environment. This condition is usually temporary and treatable, but it does occur within a few hours and sometimes days at a time. So some of the causes of this can be alcohol or drug induced, whether this be from withdrawal or the consumption of these. It can be metabolic imbalances such as low sodium, infections like the flu or UTI, and even sleep deprivation has the potential to cause delirium. So some of the signs and symptoms can be confusion, changes in alertness, whether this be a kind of a hyperactive state or more of a fatigued, sluggish state, emotional changes, problems with memory and recall, and really trouble concentrating throughout the day. And then, like I said before, the treatment really depends on the cause of the delirium, and then just managing those symptoms. An example of this could be medication management through a physician if the delirium is being caused by a medication, or even something as simple as drinking water because the individual has become dehydrated.
So the next neurocognitive disorder that we would like to discuss is called dementia. Dementia is used more as an umbrella term. So it's termed by memory loss and the loss of the ability within cognitive functions, and this does decrease independence within activities daily. So basically the science behind it is neurons in the brain are affected by proteins and fibers that cause neuronal disconnection. So underneath the umbrella of dementia, you can find Alzheimer's, which is found in 60 to 80% according to alzheimers.org. And then there's also, like Megan discussed earlier, Lewy body dementia, vascular dementia, frontotemporal dementia, and others like Parkinson's and Huntington, as well as mixed. Common symptoms are loss of memory, loss of complex attention, difficulty with communication, inappropriate language, reasoning, judgment, and problem solving. It's usually increased over the age of 65 and found in both men and women. Women are most likely to have this disorder. So the first step is we want to talk about with intervention is start with being comfortable with beginning the conversation. You always want to focus on maintaining and preserving whatever skills that the client still has. When you're ready, discuss with those loved ones the conditions and the symptoms that you have been seeing. Be able to find a physician who is ready and prepared to do a screening on their wellness exam. Also, make sure that you have a future plan of care ready for when your loved one becomes unable to perform and make those executive decisions. So I want to compare and contrast because, like I said, dementia is the umbrella and Alzheimer's falls under that. So Alzheimer's is a progressive disease that can lead to dementia, and it affects the individual's ability to perform. So some of the common symptoms are decline in executive functions, learning, memory, language, complex attention, motor planning, and social skills. According to Atchison 2017, it's ultimately affecting the ability to complete the simplest of tasks. So this does affect your ability to be independent. There are 3 stages called mild, moderate, and severe. Mild with being able to still be independent, but memory becomes impaired and you start to have difficulty with navigating familiar spaces, forgetting things, and others. Moderate is where you should be more aware of your loved ones. It starts to have more behavioral disturbances, and the client should be recommended to stop driving, as well as they should be recommended to not be left alone due to that decline judgment and safety awareness. The last stage is where the client becomes fully dependent and starts to lose all memory, becomes nonverbal, and may become bedbound. So some simple interventions, the biggest one I want to hone down on is the education training for families. So make sure that the family is aware of the environmental stressors and also how to assist their loved one with those daily activities within the mild and moderate stages. There's others such as compensatory, health management, and home modifications that are important.
So for pharmaceuticals, there really can be a variety of medications that can pose as an intervention to manage the symptoms. Some of these medications can include pain relievers and others like anti-anxiety medication and glutamate regulators to really help with memory and to reduce that anxiety that these individuals might experience, as well as antipsychotics, which can help with hallucinations and sometimes agitation. Now, all of these can come with side effects, and some of the side effects may actually resemble delirium. This can be confusion, a sedative state, and even things like nausea or fatigue. So those need to be considered as possible side effects for these medications.
So lastly, we just want to touch about how you can advocate for those with neurocognitive disorder. You want to make sure to listen to them. You want to make sure to listen to what symptoms and side effects that they have been noticing. And it's a really important thing because occupational therapy focuses on client care, and so that's one thing. You want to make sure that the client is being heard and the client is being taken care of. Make sure to be educated. So through websites like alzheimers.org, you can find things in the DSM-5, which has definitions and common symptoms and side effects of the neurocognitive disorders, as well as you can find more information through our association called AOTA. And the last thing we want to discuss is awareness. Be aware of the side effects and symptoms that you are seeing through all of these disorders. It's very common to see very similar symptoms throughout each of them, but you can find specifics and you can make sure to be aware in order to be ready to go talk to the physician about what's going on. And these are our references.